Good morning and good afternoon, everyone. Sorry for the delay on our end, but we are really excited to get started with our webinar today. I want to welcome you back to our webinar series. My name is Megan Diamond, and I'm the Assistant Director of Programs and Innovation at the Harvard Global Health Institute. I'm excited to welcome you here today for our webinar entitled Closing the Data Gap: Novel Approaches for Data Use in the COVID-19 Response. This webinar is the 7th in a series that's co-hosted by the Novartis Foundation and MIT Critical Data, which is bringing together experts from around the world to explore the role of tech and AI in the response to COVID-19, with a specific focus on those in low resource settings. On Tuesday, July 7th at 9 a.m. Eastern Standard Time, we're going to have our 8th and final webinar entitled The Role of AI in the Post-Pandemic Era. For more information on that webinar and others, you can visit our website at dashinafrica.org, and registration is now open. AI-driven solutions are only as good as the data used to train them. From accurate testing numbers to comprehensive infection rates, data are essential to understanding COVID-19 and crafting national policy, including the allocation of limited health resources. Yet high-volume, high-quality data isn't readily available everywhere, and the gap between what is needed and what is available can be substantial, especially in low-resource settings. In this webinar, we are bringing together experts from across industry and geography to discuss opportunities and challenges to meet this urgent need. Panelists will reflect on novel approaches for acquiring data, discuss the ethical and regulatory implications of their use, and dive into recommendations on how to overcome ongoing barriers to data collection during COVID-19. Before we get started, I have just a few housekeeping notes. This video is being live streamed through Zoom and Facebook Live, and a recording will be made available on our DASH website shortly after the webinar ends. We're going to be running a live Q&A throughout the webinar, so we have enabled the Ask a Question feature, which you will find on the bottom of your screen. If you have questions throughout the webinar, you can just pop them in there and we'll do our very best to answer them. We have also enabled the chat function, which will be monitored and overseen by my colleague, Caroline. When using this function, please make sure you set the message recipient as everyone and not just the panelists. To get us started, we'd like to invite all of our participants to use the chat function to let us know where you are connecting from today, including the city and country. I'm calling in from Cambridge, Massachusetts in the United States. So with that, I'm excited to introduce to you our speakers today. Sekou Remy is a research scientist and technical lead at IBM Research Africa. A member of the healthcare team, he is excited about developing appropriate technologies based on artificial intelligence, machine learning, blockchain, and data analytics with the goal of transforming Africa and the world. As the lead for policymaking with AI, one of Remy's research efforts explores the applications of technology to accelerate the eradication of malaria and to transform the development of intervention policies. Laura McGorman is the global policy lead for Facebook's Data for Good portfolio, which focuses on sharing privacy-preserving data sets with nonprofits and researchers to address crises. Prior to joining Facebook, Laura held positions during the Obama administration at the U.S. Department of Commerce, the World Bank, and USAID. Vambolole is the Monitoring, Evaluation, Quality Improvement, and e-Health Officer at Partners in Health Sierra Leone. Vamba focuses on designing and implementing mobile data collection and electronic medical record systems for health centers and community health workers. He collaborates with the Ministry of Health around the world. He collaborates with just the Ministry of Health in Sierra Leone, not around the world, on how the ministry can use innovation to improve and strengthen the country's healthcare system. And lastly, our discussion will be moderated by Bruno Vitelli, who is the Global Head of Data and Digital at Novartis. He is a serial entrepreneur with 25 years of experience developing innovative businesses and driving digital disruption with consumer goods, pharma, and strategic consulting with global leaders. Bruno's previous and current roles include CDO, CIO, venture capital fund managing director, startup founder, chairman of the board, and board member of multiple startups. He is a regular contributor to events in media globally and has been nominated as a top 40 healthcare transformer. With that, I'm going to hand over the mic to Bruno, who's going to be facilitating the conversation today.
Megan, thanks, Emilian, and thanks to all people that joined us today for what I'm sure is going to be an exciting panel. And I thank my co-panelists in joining us today. So as you said, we're going to, during this webinar, reflect on novel approaches for data use in COVID, and I would say in overall pandemic response. Hopefully during this webinar, we will touch upon different dimensions that are relevant to this topic, like ethical, regulatory implication, barriers, but probably most importantly, what are the practical solutions and responses that our panelists and their teams have enabled to help respond to the current crisis. So very happy to have Laura, Sekou, and Vamba joining us. To the three of them, I'm going to hand over to you today, and probably the best is to listen to you, maybe a kind of a positioning statement, opening statement. What is your take when we talk about novel approaches to data to respond to emergency like we're facing today? And let's start with you, Laura, if you don't mind.
Me too. Thanks so much, Bruno, for the warm introduction, and to Megan as well. So I'd say on the Facebook side, it's been a really important and a motivating time in terms of sharing real-time information to combat the COVID-19 pandemic. We have been working on the Data for Good team since 2017 on different applications of real-time information from the Facebook platform. And we started in natural disasters with a set of tools called disaster maps. A lot of people, when they think about Facebook data, they think mostly about sentiment analysis, because people associate Facebook where people go to share their thoughts and perspectives on issues. But like so many applications that people use on their mobile phones, when people opt into a feature called location history, we have pretty good location data. And real-time information gathered from GPS location data is really helpful, not only in the context of a natural disaster to better understand things like whether or not people are evacuating before a hurricane makes landfall, or whether or not they've gotten out of harm's way when a wildfire is ongoing, but it can be very helpful in the context of tracking the pathway of an infectious disease. And so in 2019, when we started doing this work on disease prevention mapping, we thought that the major use case was going to be things like flu or measles. Little did we know that there was a global pandemic headed our way that was largely going to be tried to be controlled with what are called non-pharmaceutical interventions. So what are the extent to which people are generally staying home during a lockdown order? Do we have a general sense of whether or not people are greatly out and about compared to pre-crisis levels? And all of that information can be largely facilitated by the availability of high-quality location information. So I think it's been a really valuable time in terms of showing the importance and necessary input of this kind of information into disease modeling. Just for context, I don't know how many epidemiologists we have on the line, but what we've heard from partners is that in lieu of location data from tech companies, people were using commuting patterns data that was sometimes 10 years old. I mean, just very out of date, very assumption-based inputs into disease forecasting models. And conversely, since the onset of the COVID-19 pandemic, almost every disease modeler or agency we're talking to is using either Google location information or Facebook mobility data or mobility data from another source. So it's become overnight this sort of ubiquitous input into epidemiological forecasts, which I think is really a huge change and is important. I think where things are challenging, a lot of people assume it's privacy. I think privacy by design has been part of our approach in Data for Good from the onset. And so I actually feel pretty confident in our approaches there. I think what the balance is when you're trying to provide as much information as possible to be helpful during a pandemic, there is this trade-off between resolution and privacy. And this is something we're dealing with right now. So for example, we share mobility data typically at a county level to be able to preserve privacy. And then through license agreements with nonprofits, we also can share mobility data at even a finer grain resolution. In the last week or so, as we see cases rise throughout the United States in particular, people are asking for more finely grained mobility data. Can you give us age breakdowns? Can you show us mobility data of just the youth population? Now that's technically possible, but to preserve privacy with every further disaggregation you do, you actually lose resolution. And so there's this inherent trade-off of preserving a sufficient number of users such that re-identification is not possible. But if you wanted to further disaggregate mobility data into age group or by gender, you'd have to share it at sort of a more coarsely grained resolution. And so I think that's something that as a community, I think we need to figure out, community of data providers, researchers, and others, what's the right trade-off? Is it more important to be able to get mobility data at a zip code level, or is it more important to be able to get mobility data at a county level by age bracket? I mean, they're more research questions, I would say, that we're battling because we have a responsibility to protect privacy and we'll use techniques to do that. But making sure that we're doing that in the way that's most effective for our nonprofit and research counterparts, I think is an ongoing question. And I'd say that the last thing I'll say is, this goes without saying, anyone who uses information from tech companies or mobile phones in the developing world, representativeness is a problem. I think I'll leave that some data, we would argue, or what we hear from our partners is always better than no data, even if it needs to be heavily caveated. So I'll stop there, but look forward to the discussion, and thanks for the opportunity.
Excellent. No, thanks, Laura. And already in your introduction, a couple of really interesting points. The notion of a trade-off, obviously, is something we will certainly come back to in the questions I will ask you in a minute. But let's first give a chance to Sekou to give us a kind of an overview on how, through his work and his teamwork at IBM, they're also leveraging the novel approaches to data. Sekou?
Right. Hello. Thank you, Bruno. And it's a pleasure to join this particular group, energetic group that is doing amazing things in different parts of the world for the benefit of all. Also, welcome to the 71, now 72 people who have joined, also from various locations in the world. I get the wonderful opportunity to represent IBM Research today. IBM Research is a small part of IBM, just 3,000, 4,000 researchers in a larger group of 400,000 across all the world. So there are many things happening within the IBM community in terms of the way that we're supporting governments, clients, and other partners. So some of the things that people might think of a tech company doing in terms of processing structured and unstructured data, there are many of those efforts that we are giving to the community. So I mean, I'll put up a blog post, but if you just do some Google searches, you can find out some things that IBM Research broadly is doing. But I'd like to talk specifically about what the team that I'm working with, a Kenya-based team, but we're growing. We're small, but growing. And basically, we're looking at the problem a little bit differently. So just as Laura pointed out, there's amazing work happening in the epidemiology space. And that work is being informed by some really, I mean, it may be new for the modeling community, but it's not really new because they've been doing these things in their own ways previously. I think the integration with the tech companies, the ability to have data license agreements that actually make sense for their workflows, those things are happening now in a manner that is really synergistic. Our group is actually saying, okay, let's do something a little bit different from what everyone else is doing. You look in COVID, you see many data dashboards. You look at COVID, you see many model repositories. But what we're saying is, let's apply artificial intelligence to more heavily extract insights from those models, from that data. So treat the epidemiologist's insights, which they've encoded into a model, as a valid source of information about what could happen in the future given an intervention program. So this now is framing the problem in a manner that some in the AI community would know and resonate with them around having an environment that their algorithms can now interact with. So in essence, instead of asking people to play AlphaGo or chess or checkers, we're now saying, apply your algorithms, those algorithms that you've been spending a lot of time crafting, to epidemiological models, whether it's around calibration of those models or it's around looking into the intervention space so that you can understand, okay, well, what might happen if we did this particular thing? As the models get richer, and there's some amazingly detailed models, whether it's agent-based or compartmental, there's some really amazing models out there that have reasonably good predictive power. However, when we look at what's done today, very small portions of the inputs, of the input parameters or the intervention parameters are evaluated in silico. And we're saying AI can help in the process of engaging with those models in a principled manner. So, thank you.
Oh, excellent. No, that's really interesting and exciting. I would love to go back at some point to the notion of synergistic, how we're combining the effort from multiple data provision or data sources and the power of these people that have algorithms that can start being applied to these data sets. That's really, I believe, the power. Let me now move to our third panelist, Vamba. Thanks for your patience. We'd love to hear a bit more about what you're doing in Sierra Leone. Very impressed by the work you're doing with partners in health. So Vamba, back to you.
Yeah, so thank you for having me. Partners in Health is one organization that is always focused on supporting the Ministry of Health in strengthening the health system of the country. So as an organization,
it's a bit difficult to hear you, Vamba. Any chance you could get closer to the mic?
Can you hear me now?
Slightly better, but really slightly.
Wow. Is it better now?
Yes, probably if you speak a bit louder, we will be able to hear you.
Okay. Okay. So I was saying
okay,
Partners in Health is our good now. So Partners in Health is one organization that is really involved in helping the Ministry of Health in strengthening the health system. And one of the key components we are actually focusing on is how we can improve on the data system of the country, supporting the ministry to make data-driven decisions around healthcare. So during the Ebola outbreak, we had a lot of experiences, a lot of lessons we learned, and we actually developed some tools, specifically CompCare, which we did use for contact tracing as well as community household screening. So when we had the COVID-19 outbreak, we already had a system in place. So this is exactly like the kind of things we had wanted the ministry to have learned from the Ebola outbreak. So there was already a system in place in Kono. We already had a system screening people at different facilities. We had a lot of community health workers within each communities doing household screenings. So we basically have more challenging in identifying what we were to use. So we already had a tool that we already used. What we did was to just continue using this tool for COVID-19 response. So like the data we have been collecting has been helping a lot as compared to like other districts where they have basically no tools and or are actually still struggling with finding tools to use for COVID-19 response. One of the key challenges which is actually being faced by other districts here is they are still using paper-based. They don't have like enough data to support decisions around COVID-19 as compared to what we have recently done here in Kono, having people being screened from every facility before they do enter the clinic. So we have enough data to make a decision around COVID-19 as compared to other districts.
Excellent. Look, thank you, Vamba, and I guess we are lucky with the technology today, with our three panelists managing to get through. So let me go back to each of you with some questions, and then I will be happy to open to questions from the people that kindly joined us today. Laura, maybe back to you. You talked about how with Facebook you are kind of reinventing the provision of epidemiologic data, at least for some of them. We talk about real-time data like location data. I guess my question is, how do you envision this in the future? I mean, would you envision this to go beyond location data?
Well, I mean, I think it depends on what kind of disease you're talking about. So location data is only going to be useful in an infectious disease or a contagious disease. I mean, if you're talking about the spread of cancer, it's probably not going to be helpful. But I do think that, I mean, something we've been talking about within the community is making sure that this isn't a one-time approach, right? So we now have this network of epidemiologists around the world who are using our data to support the public sector response in, I don't know, I can't even keep track of the number of countries, but we're sharing data for 150 countries, and it's being used, I would say, in probably 50. And we've been talking about how, it's hard to see past COVID-19 right now, but there will be a vaccine at some point. And how do we make sure that this type of collaboration continues for things like measles outbreaks, for things like flu outbreaks? And I think the operating model is something that we are more invested in seeing continue than I think the data itself, right? So what I've been very encouraged by is there's this value chain of information, like, location information, other information coming from Facebook and Google and other tech companies that are contributing, finding its way in the hands of researchers. And then those researchers being really committed to working hand in hand with the public sector. There's just, I mean, I'll give you a couple of examples. Andrew Schroeder, who is the VP of Analytics at a nonprofit we work with called Direct Relief, talks to the state of California and the governor's office every single day. They review mobility data. There's like a joke that the governor reviews it with his morning cup of coffee. We have seen Facebook mobility data presented at press conferences with the president of Mexico, and their chief data officer, a woman named Paola, is really invested in better understanding mobility trends in real time to be able to better tailor messaging and the overall response. And so I think for us, it's talking about that value chain and the set of actors. How do you create data products that are useful for the public sector, and how do those get acted upon in real time? And so whatever is happening at the top of the funnel where we are, I'm more committed to better institutionalizing that operating model and that value chain.
Oh, that makes a ton of sense. I think many people are talking about the new normal, but indeed, it is my sense as well, Laura, that without an operating model and a commitment on new ways of working, that there might not be a new normal. Yep. This notion of operating model will bring me back to you, Sekou, if you don't mind. You talked about the synergistic approach, and I reflected on that because I indeed believe, and again, in Laura's point, it surfaces loud and clear. It's about collaboration, bringing the wealth of data, the wealth of analysis, the wealth of research. IBM has always been an organization I admired in your ability to drive research. So I would love to ask you what lessons have IBM learned in leveraging your role as a global leader to promote these synergistic approaches you referred to?
That's a very tall question for a person who has only been at IBM Research for 4 years, but I'll give it a shot. IBM is a well-established company, so over 100 years old. And as a company, it's had the opportunity to reflect on how it operates. We have leadership that actually is interested in the process of how research is done and continually ask questions. Do we have the right partners? Do we have the right relationships? Is this the right thing for us to do? These are questions that as researchers, we're always asked to consider. One of the elements in terms of IBM is also that, as you mentioned, it's a global company. So for example, I sit right now in Nairobi, Kenya, working from home, but my lab is 10 kilometers away. There are IBMers on every continent. I don't know who the IBMer is in Antarctica, but I'm sure that there's one there. So what happens is that as a company, we're looking at the relationships we have. We're understanding the problems that the research community is experiencing, whether it's within IBM or it's through a partner relationship. But more specifically, because of IBM's corporate research, there's an element in terms of being able to have partnerships that are sustained, being able to understand what are your partners' pain points. So for example, if we happen to be working with a government client and provenance of data is something that they're really interested in, then that's something that we're really interested in. These are problems, whether you're a Fortune 500 company or an entity, university, there are questions that you have about the provenance of data, the provenance of models. What are alternative views or alternative insights which could be extracted? This concept of bias and explainability, these are all things that IBM Research cares about. So from that background, and it's not just about, okay, well, we're a tech company, because we're a tech company that also does things and does research in terms of physical sciences. So there's biological sciences. So one of the things that I mentioned in the intro is there's work that we're doing around, I didn't really spell it out, but in terms of gene sequencing, right? So there's also work that we're doing in terms of structured and unstructured text data, leveraging the assets that we've built and providing those things to the community so that they can dig into all of this literature that's coming out about COVID, whether it's in articles, blog posts, press briefs, or multiple sources like that, whether it's Twitter, Facebook. There are all of these sources of structured and unstructured data that we're saying, yes, we have looked at these problems for other domains, but we're also sharing what we've learned from those past experiences with the communities. So basically, we're doing this together with our collaborators.
Excellent. Thanks, Sekou. Vamba, back to you. You know, I said in my introduction that I would love you guys to share some of the challenges and some of the solutions that you found during this unprecedented times. So I would love to ask you. You know, you've been working with ministries of health on health system improvement. So I would love to hear from you, what are some of the biggest challenges or bottlenecks that you've seen in regards of data usage? And maybe also whether you think that there are some quick wins that the low and medium income countries have as advantages compared to the high income countries. Vamba, you might be on mute.
Hello.
Yes.
So for countries like Sierra Leone, I think we, at this COVID-19 response, we were at a very big advantage due to the fact that we had the Ebola outbreak a few years back, and there were a lot of lessons that were learned around what data actually was needed to fight the Ebola, which could have been like good lessons we could have implemented for the response for COVID-19 as well. Most of the challenges around data issues has been what tools can the government use in responding to outbreaks like this. So in most cases, you see a lot of organizations that support the Ministry of Health will come supporting with tools, designing tools, and after the outbreak, you see those tools, you will see them using those tools again. And for example, like the COVID-19 response, and the Ministry of Health is still kind of struggling with what kind of tool, what kind of electronic platform they should use for contact tracing as well as household screening. And as partners in health, what we have been doing is that we design system and we maintain those systems. So the systems we had, the application we are using from Ebola response is the same application we are using. So these are like some of the things we actually expect other partners that are actually supporting the ministry, and the ministry should also put effort in making sure whatsoever tool they are using for responding to an outbreak should stay with them, and whenever there is another outbreak, they will not have like issues around selecting what tool they are actually supposed to use.
Great, thanks, Vamba. another point I made in the introduction is something that, Laura, you touched upon in your own introduction, which is the the privacy, the ethical aspect. You talked about all the work that you're doing with and at Facebook around releasing the Facebook movement range maps publicly, and with some of what I understand you call the differential privacy. Could you come back to this notion of differential privacy and how you envision to address this privacy, this trade-off, as you called it, in the future?
Sure. Yeah. I mean, I think that there's different levels of privacy protection. So when you apply a differential privacy framework, statistically, what that means is that you add a small amount of noise that does not actually change the outcomes of an analysis that you would do, but it basically makes it impossible to re-identify people because you've obscured the actual number of observations in any one geographic boundary. And so what we found during the COVID-19 pandemic is that because there has been such a massive level of demand for mobility data in particular, having that kind of data available for license agreement only, while there is a level of access control that is comforting when you approach things that way, and we partnered with 325 universities and nonprofits at this point, so we were excited by the level of access we could offer through that approach. But then when we saw that, every public health institution around the world was trying to get direct access to mobility data, we said, all right,
The internet struck again.
Yes, it seems that we have lost Laura. Hopefully she will be able to reconnect in a second and conclude her response on this question about privacy. Let's move on in the meantime. And maybe Sekou or Wamba would love to come back to this notion about initiative and cooperation between different partners, and especially in low and medium income countries. We've seen an unprecedented level of cooperation in some shape or forms. Both of you talked about it. I guess the question is what kind of measures do you think we need to take to consider to ensure this is sustained engagement and not just during the pandemic? Maybe Sekou, you want to start, or Wamba, whichever.
I can give it a shot. So I joined IBM Research just after the Ebola pandemic, the last Ebola pandemic, I should say. And it was really interesting from my perspective because I was coming from academia into a corporate research lab. And one of the struggles that exists is how research is done in a corporate context. Intellectual property it's important, and these are things that need to be managed. But even impact is something that is also important. So I got to join this particular research lab at a time where it was going through this soul-searching process around how collaboration is done. What are the mechanisms? So our lab director, the lab director who I joined under, basically said, we need to make sure we're getting things out of the lab, and we need to do things in a manner that they are sustainable. So some of the questions that Wamba has raised, these are things that we were actually learning from because we were part of research efforts, but there's a difference between a research effort and something that is intended for like indefinite use. So as researchers, we had to reflect on elements of what's our product life cycle for a research product, and what are the elements of those research products that can be open sourced or integrated within existing platforms. That said, there's this COVID-19 pandemic has, I've seen a lot more, you can call it South-South collaboration, than I have seen in other contexts, in other disease domains even. The amount of data sharing that is happening, and the amount of not just sharing, but actually data reuse, dashboard reuse. it is significantly higher than I've ever seen for any other thing. So I really do hope that we're learning these lessons as a community. The type of license that we use to develop the software that is written, key. The type of partners that we collaborate with to make sure that it's not just a one-off, or it is actually something that is able to be worked into an existing workflow is key. We don't just want to do something that changes how people do their work and then say, okay, well, we're gone now that we've gotten a paper out of it. That view is something that within, at least I've gotten a chance to see personally within IBM Research, is something that we're saying, we're not going to do that. We're building relationships. We're seeing what we can do for a longer time frame.
Great, thanks, Sekou. Vamba, you already mentioned some lessons that you were drawing from previous pandemic, and you quoted Ebola. Any addition to what Sekou said about this, these measures we could take to make this very unique and unprecedented collaboration stick with time? You're probably on mute, Vamba.
Yes. It will be very great if for institutions or organizations that are coming in during an outbreak to support Ministry of Health to actually distinguish what whether the tools they are coming with is for research purposes or they actually come in to kind of strengthening the health system, which is something Partners in Health is doing. So as an organization, we don't actually just respond to outbreaks, we actually stay and make sure the health system is strengthening. So whatever tool that we are designing, we design it along with the Ministry of Health. So that is even why you realize all the tools we recently designed, our forms as well as our electronic medical record systems that are at the government hospitals actually do align with the ministry reporting systems. So these are some of the lessons actually we expect for the ministry to learn, that whenever we have a system, it should be sustainable. You should not only use a system to respond to an outbreak, then that system goes away. When there's another outbreak, you keep fighting to develop a new one.
Great. No, that makes so much sense. I see that Laura is still trying to connect back, but we will hopefully have her back with us before the end. Or maybe Laura, you're back now? Not quite yet. Just give her. Let's give her one or two more minutes, so she can talk again. Maybe one question for the two of you, Sekou and Vamba. Laura talked about the trade-off. I think she was talking about the trade-off between resolution and privacy. Would love to hear you talk a bit about what is your take on ethical and or regulatory implication of those advanced data collection and the way they're used now. Maybe Vamba, you want to start first this time?
Yeah. So what we actually working with the Ministry of Health is how we can put strategic information in place around the use of data and what tools they are supposed to be using for healthcare systems. So we are actually working on several documentations that will be used as a national guidelines, which will actually guide around the security of the data and how the data should be used to improve the healthcare system within the country.
Great, thanks. Sekou, any addition?
Yeah, this is something that both inside and outside of IBM I think about a lot. One of the elements, and I'd like to highlight this, when we're talking about data in a COVID context, in many cases we're talking about lives. So when you talk about a person who has contracted COVID-19, that's a person first, or a person who has died, that's a person. So this notion of just treating data as just a nameless, faceless NumPy array or a CSV file, that's something that many of us have to maybe sometimes remind our colleagues. So we're talking about things that impact people's lives, that's one. The other element is data sharing. It's critical. If we're not if we don't have access to the right data to support a decision, then maybe the right decision may be made, but it's made for the wrong reason. That's a best case scenario, right? The worst case scenario is basically we're making the wrong decisions and maybe we don't even know it. So data provenance, it's critical. On the side of now ethics, there are two elements that I'd like to highlight. One is this notion of what you use the data for. Were you given data for a particular purpose and now you have decided that I can repackage it and get some other benefit that you didn't ask for? That's a problem from a research perspective, and even from a practice perspective, that's a problem. Then there's the other element of how do you share data? How do you make sure that you have that kind of transparency so that if somebody wanted to, they can understand, here is the data that I use to make a decision, or here's the data that I use to provide you with a recommendation. These things are critical from a research perspective. And I can say that I joined a company that actually, like, it is more important. Like, this notion of reputation around data management practices, data hygiene, it is drilled in, and it is really critical because, as you notice, there's some research studies that have been pulled. There's a lot you can talk about with these research studies, but at the end of the day, it came down to this notion of we can't trust the data or the data management pipeline, and these are things that are essential. When it comes to low and middle income countries, these are things that are, I mean, there are some things that you see in terms of practices that you're like, wow, I don't think anybody's paying attention, or making sure that we're clear about what the regulations are around data prevalence, where you can store data of a particular type, who has access to things. These are things that many countries are many countries are figuring out for themselves on their own terms. We can't just do things like saying, oh, we'll just apply GDPR everywhere in the world, because some of the cultural context of GDPR may not make sense in other places. However, these are things that have to be sorted out because, again, one, there are lives involved. Two, there's very important decisions that are being impacted by the quality and the provenance of data. So, like I said, I've been thinking about this for a while.
Great, thanks, Sekou, for a very comprehensive answer. And I'm glad to report that Laura is back with us. Right, Laura?
Yeah, I'm here. Thanks.
Okay, excellent. We're happy to have you back with us. I think you were cut short in your answer on privacy and how you're approaching it at Facebook. In the meantime, with Sekou Mvamba, we continued in talking about ethics and in the use of data. Maybe you want to just wrap up on that, and then after I will take some of the questions that we're receiving from the attendees today. So to you, Laura.
Sure. Yeah, I mean, I think what Sekou was saying about purpose limitation is really important. And again, that's an open question, I think. You know, when you have universities and nonprofits sign license agreements to get access to data, they signed for a particular use. And so it's fairly easy to control. You know, if it's Harvard School of Public Health is using mobility data to better understand how COVID-19 might spread, at the enforcement they're pretty easy. I think when you license something under Creative Commons, you kind of give up those purpose limitation rights. And so I think having a privacy by design approach, not just a privacy by design approach, but almost like a red team kind of approach in how might this data be used in ways that we can't anticipate, I think is going to become increasingly important as we push more data to the public sphere, making sure that we're protecting for certain applications based on either the geographic spread of the data set being shared, again, the resolution of the data being shared. I think those are sorts of questions that are, I'd say, two parts about privacy, but probably equal parts about purpose limitation as well. A good example for our population density maps is that we make some of the world's most detailed population density maps. And that is something that you can redo if you wanted to Google Earth every, because we're built with satellite imagery. If you wanted to Google Earth every village that exists on the world, you could do it. It would just be very slow. And we've had to be mindful about maybe not releasing those in places where there's active civil conflict, where really high resolution population density data could be a risk. And so that's something we've thought about, you know, are there countries that you just simply would never release data publicly for. Again, are there geographies, are there demographic breakdowns? You have to be really careful about breaking data down, even to things like gender, even if you're never going to break it down by things like you know, more sensitive categories. So I think these are questions that we think a lot about, but I think the international community can be very helpful in providing standards and guidance on how to do some of this right.
Thank you, Laura. So I'm going to start picking up some of the questions coming from the attendees, and please, we still have like 6 to 8 minutes to go before we wrap up this webinar. So please feel free to send us your questions. One question that came up to the panelists is, what have been some of the unexpected sources of data collection that has been used in the COVID response for you? And kind of in parallel, what is one data set that you wish you would have access to and that you don't have access to? So who would love to take that up? Laura, maybe you start with, and maybe we'd love Vamba, your viewpoint. So what is some of the unexpected source of data collection you have seen used, and the ones that you wish we would have?
Yeah, I mean, I'd say that I've been really impressed by the combination of mobility data with economic information. So we have some collaborators in Italy who are looking at how in various provinces in Italy, basically lockdown orders seem to increase economic inequality. And so using real-time sort of information from administrative sources on economics, I thought was a really interesting combination of data sets. I'd say the obvious data set that we wish we all had was the true number of cases. I mean, in the early days, it was just like, we don't know. We don't know if we're testing 50% of people who have COVID-19. We don't know if we're testing 4% of people who have COVID-19. And then the availability of that data for our EPI partners has just been, I mean, an ongoing headache. I know that Johns Hopkins has been doing a pretty good job trying to share this information, but it's not available everywhere. It's not available at the resolution that people need. So this is a very interesting open question, right? So if you have mobility data available at a county level, great. But if you only have case data available at a country level, like your EPI model, the existence of that more finely grained mobility data is kind of useless, because when you combine the two, you're just peanut buttering then a national total number of cases, which means your model is going to spit something out that's at the national level anyway. So case data is the data that I know everyone wishes they had.
Good, thank you, Laura. Vamba, back to you. An expected data set you've seen being used and the missing one. Vamba, can you hear us?
Hello.
Yes.
Can you repeat the question again?
Yeah, so the question from one of the attendees is, which data sets have you seen being used in responding to the COVID-19 that you were not expecting? And conversely, which data set were you really missing?
Well, I think from Sierra Leone, I think the amount of data that is actually required for the response to COVID-19, I can say there is not enough data being collected at the moment. We have data just collected from the lab, and in as much as we don't have, we have not got like enough data from contact tracing as well as household screening. So I cannot say there's that much data that is available now to make real decisions around patient care, COVID-19 patients. So the data that is available now is around the number of deaths as well as the number of tests that is done per district. So there isn't that much data available at the moment. So like for Kono, we have enough data, but Kono is just one part of the country as compared to like 14 to 16 districts within Sierra Leone.
Great, thanks, Mamba. Another question, a few questions are around data coding standards. And I think it's probably going to be one of the last questions we pick, and I will ask each of you to formulate a point of view here. So data coding standards, probably the way of putting it across is, just as getting an access to the internet requires protocols as a mandatory condition, can you see a future in which there will be a standard global protocol for health data exchange? Data coding exchange today comes at the expense of leveraging the data the way all of you have discussed so far. So maybe Sekou, you want to start first on this one, please?
Yeah, I can give it a shot. And so data exchange, this concept is not new. There are existing standards for data exchange. There are many of them. The question is whether the people who are curating these data sources are aware of these standards, and whether they're even like having a dialogue with others who may be downstream consumers of the information they're created. So that's one. I don't know that there will ever be, quote, just one. I believe that there will be multiple competing standards, just as people are looking at for like a personal health context, there are multiple standard formats, or there are multiple formats which are now being standardized. Same thing with electronic health records. There are multiple standards. But the question comes down to what are communities actually using? What reflection is happening within those communities about the efficacy of a particular format or a particular mechanism for sharing? And just to quickly jump back, in addition to case data, I would also say if we can get gene sequencing data, especially for sub-Saharan Africa, because we don't have enough of an insight for what is happening as the disease evolves in the African populations.
Excellent, thanks, Sekou. Laura, what do you think? Global protocol, multiple protocols?
Sure, I mean, I think it's funny because this question comes up a lot, and it's always asking practitioners to comment on things that ultimately lawyers need to agree to. Like, sure, but this is going to be a different question as to whether or not IBM's lawyers are going to feel comfortable with the same language as Facebook lawyers are going to feel comfortable with the same language as Amazon's lawyers. So I feel like it's kind of like, I don't know, asking a bunch of researchers how they feel about, how Netflix should do their job. It's like square peg, round hole. I think that the conversations around protocols and license agreements and streamlining that honestly needs to be a conversation with legal teams around the world. And then if international institutions want to create more like data use guidelines, I think that that's fine. But to be honest, the rubber hits the road when you build out languages of actual agreements that are signed and sort of, enforceable. And so I think we should be focusing on getting various legal teams bought into that as an exercise rather than practitioners.
Great, thank you. And maybe just before I hand over back to you, Megan, Mamba, any viewpoint on this question?
Yeah, so this protocol thing is actually something that people ask about a lot. And I believe that this is something that we actually take probably a very long time before we can handle, because looking at the different contexts of every geographical area, for example, like Sierra Leone, like a specific protocol that is being set for certain country could not probably apply to Sierra Leone. So this is something that will be very difficult to actually address. It's the same thing as to the standards of tool, just as my co-panelists mentioned around the electronic medical record system. So the standards for electronic medical record system that another country might require could be different from Sierra Leone, as well as the mobile data collection tool that are used in Liberia, Guinea, or Rwanda could be different from what we need in Sierra Leone. So most time you see like country face challenges when people bring in tools, already designed tools, and they say this is what we want you to use for this response. So the key thing is how you can come into the country and sit with the ministry or stakeholders, and you design those tools and make protocols around how those tools will be used. Will be one of the best ways to respond to this COVID-19.
Thank you, Vamba. So many thanks to the three of you. Megan, I'm going to hand over to you to conclude this webinar. I think it's been truly a global discussion from Africa through Europe to the US. I hope that we've unearthed a number of interesting insights for people who kindly joined us today. I thoroughly enjoyed the discussion. Thanks again, Laura, Sekou, Vamba, and Megan, back to you.
Yeah, great. Thanks so much, Bruno, for facilitating that conversation. And many thanks to our panelists, Sekou, Vamba, and Laura, for that incredibly rich and grounded conversation. We know how busy you are, all of you, and we deeply appreciate the time you've spent with us here today. And so I want to thank our audience as well for joining us and submitting thought-provoking questions. Thank you for hanging in there during some of our technical difficulties. And we hope to see you on our next webinar, which is on July 7th. And so with that, have a wonderful afternoon or evening, wherever you are, and take care of yourselves and others. Thanks so much.